is a problem touching every neighborhood in our area, regardless of race, age, or income. Kicking a heroin addiction can be a fight for your life.
And for many, it's the most difficult fight they'll ever face. WSBT-22's Bob Montgomery is here. And Bob, you found the help they need to win that battle might not be available around here.
That's right, Rick and Jen. Drug treatment availability in this area has really been a pendulum that went from many facilities and lots of services to very few or none for some of the most critically needed.
The lady told me once that heroin was like the devil and withdrawal was like hell. It's a very painful process, a very uncomfortable process.
And apparently a too often delayed process. Sharon Burden has worked much of her adult life trying to help people with addictions get clean, get their lives back. Today, as the executive director of South Bend's Alcohol and Addictions Resource Center, she's frustrated. Frustrated the infrastructure that used to be in place to handle patients needing life-saving rehab just isn't there anymore.
There were a ton of treatment providers offering inpatient type services. And now we've kind of come back to the point where there are no inpatient services in the community. And it seems as though, at least from what we hear, is that many of the providers are just at capacity.
It's estimated there are up to 30 million Americans right now addicted to drugs or alcohol. Now, it's hard to say how many of those fall specifically into the heroin category, but Burden says it's safe to say that number is only going higher. One local young woman fell into that web of heroin. Her parents, Ann and Rich, think she may have started after getting prescription pain pills for a cheerleading injury and moved up to needles and heroin. Now, the couple doesn't want its last name used, but was willing to talk to us about the frustrations of finding no long-term inpatient local help once their daughter decided it was time.
We were hoping that there was some place she could go right away, but there wasn't. And
what were you thinking when you found that?
Just devastated, you know, because now that she's ready and she doesn't want to do this anymore and she's ready to get the help, now there's no help for her to get. You know, when you'd call on Monday and then you would talk to, your child again, and they'd be like, I'm not going anywhere. I don't want to do that anymore.
The director of addiction services at Oak Lawn and South Bend and Goshen understands that devastation.
Pretty much the research is clear that when somebody is ready to get help, the faster the better. You got to strike when the iron's hot when you're dealing with substance abuse. The longer you wait, the less people are invested in the treatment process.
And Horsley says the numbers are not on our side.
Once they're on heroin, typically, there's not a lot of resources for them to access those programs. So then we're looking at, the 6 to 8 week wait.
Because of that wait, he estimates 50 to 60% don't show for the first assessment to learn what services are available. Horsley and Burden agree. Getting more locally based, inpatient, long-term, medically based detox centers is a critical need for the area. Kevin Moore is the director of the state of Indiana's Division of Mental Health and Addictions.
There's a recognition that there's a gap to be filled, and our approach to whether it's a mental health treatment or to addiction treatment has always been, what do we need to do for the consumer? What do we need to do for that individual to connect them to care?
And to fill that gap, the state is already spending $47 million this year to treat addiction. Moore says there's also a new funding stream of an additional $10 million this year and double that, $20 million for next year.
I think sometimes there's this idea that we are going to just wish them well. We're going to get them cleaned up off of drugs and then kind of push them off and say, stay sober. And it's just really hard.
Horsley says in his experience, he's seen more people die in the last 5 years by far than his previous 15 years in practice. And if nothing changes in the next 5 years,
we'll continue to see the heroin and opiate deaths rise.
No doubt.
No doubt about it.
The experts agree another issue is paying for this rehab. You have to have the cash or the right kind of insurance options, and they're much more readily available, often though someplace else. But Rick and Jen, that is not the case for the underinsured or the uninsured.
Yeah, different story there. So what's being done to help these people to get them the treatment that they need?
Well, really the state is trying to step in. They have something called Recovery Works. There's also something called HIP 2.0, which is Medicaid.
Right.
And for the first time, they're actually covering addiction services. Now, the state, you saw Kevin Moore just a moment ago. He's one of the directors of the State for Addiction Services. He says they're really trying to build in more cash into the system to help try to fill that gap, because there really is a critically needed. So many people feel this is so desperately needed in the area.
Yeah, it's a major problem right now. We're talking all over the area as well.
Absolutely.
Okay, Bob, thank you so much. And tomorrow, we're digging into the battle to keep people alive when they need emergency help. While Narcan can reverse the effects of an overdose, it's not a simple fix. That part of the heroin epidemic story tomorrow on WSBT 22 News at 6.